On live. Hi, I'm Dr. Cheryl Trudy, owner of Balanced Physician Care. Welcome to our Facebook Live presentation that we have on a regular basis. It's our health lunch hour talks. Today, we're here with Dr. Michelle DeFleece-Huck, and we're going to talk today about oral health. Our practice, Balanced Physician Care, is located at the Beaches. And we do a holistic primary care practice. My guest today, Dr. Michelle DeFleece-Huck, is owner and operator of Jack's Beaches Family Dentistry, located at Neptune Beach. Their website is jacksonvillebeachdentist.com, and their phone number is 904-247-0111. Well, welcome, Michelle, here today. We're going to talk, I think, about a topic that some people know about but may not fully, completely understand, and that's the connection between our mouth and our health.
Yeah, it's especially interesting to me because I've been doing dentistry as long as I have, but I love being part of the complete health movement because there's so much information in the news today about the latest research that has especially recently been focused on, the health of the mouth, inflammation and bacteria in the mouth linked with cardiovascular disease, including heart attacks and strokes. So the level 4 research showing that it increases your likelihood of a heart attack by 50% is something to really take a close look at, in terms of prevention and in terms of, making somebody healthier who's, already started to have issues.
Yes, you're doing, like you said, you're kind of a part of a unique movement in dentistry, sort of this complete health dentistry movement. I mean, I know you come from a family of dentists. Mm-hmm. You've had, an opportunity to be the daughter of a dentist as well as a dentist yourself, and you've been, at your practice for quite a long time. And this really, caught your attention and sort of, you guys have been doing a lot of new and unique things at your practice.
Yeah, we're able to assist people in what's considered, traditional dentistry where, you clean your teeth and you check people's gums. But what we're finding is that inflammation and the bacteria in your system can actually clot on the heart. And also they're finding when they do biopsies on those clots that there is actual oral bacteria in there. And after doing extensive studies that include, tens of thousands of patients in those studies, that there is actually a direct link. So we're being more assertive about, not ignoring that inflammation, not ignoring the bleeding gums, and not waiting until there's a significant disease to address it. So it's really, assertive, proactive education for all of our patients about how much of a concern it is, that when your gums are bleeding, you have an infection the size of the palm of your hand in your body, and it's an open wound with direct connection, to your bloodstream. So we're just, we're being more proactive about it, and we have modalities in our office that are new and interesting and exciting.
Yeah, when we talk, often about chronic disease, in the holistic realm, and as I trained with Dr. Weil. He's a big proponent of the anti-inflammatory diet. And there's a real feeling in medicine that, all chronic disease at the bedrock is, inflammation and chronic inflammation. And, we spend a lot of time in medicine and in trying to educate patients on, eating healthier, to be able to improve and decrease the amount of inflammation in their body. And we talk to people about exercise, and we talk to maybe them about herbal supplements that can help with that. But here, we go with some kind of a new perspective, is that by really taking care of our oral health and our dental health, we can make a huge impact on our medical health as well. There's several different areas and chronic diseases that good oral dental health can help prevent.
Absolutely. So, that's the same in complete health. We have that same viewpoint, that the chronic inflammation of periodontal disease has the impact on all those different things. And so one of our initiatives in the complete health movement, and there's 7 of us in Jacksonville now that are involved in the movement, is to not have it be an isolated conversation. So, I'm sitting in my dental office with Mrs. Smith, and she has terrible periodontal disease that's been untreated for decades. If she's also your patient and you're trying to treat her, with improving her diet and, lowering what you know about inflammation, and we don't and we don't ever communicate with one another, we can get very frustrated, and the patient can get frustrated. And, worse than that, the patient continues to get sicker, Or if it's, let's say it's a young person trying to be proactive and you get her diet all cleaned up, and from your perspective, her inflammation is gone, but yet she hasn't had a cleaning in 5 years. So we're excited about the opportunity to, just keep a conversation open with amongst all, health practitioners in Jacksonville to get everybody healthier.
Well, a lot. Yeah, I agree. And a lot of people don't realize the link between, oral health and a lot of different diseases. One link that people often do know about, and that's heart disease. I was really surprised by the statistic that I came across that, 50% of MIs, have some link to oral inflammation. I mean, that's a pretty staggering statistic, when it comes down to preventing a heart attack.
Yeah, and there's several physicians that are, hyper involved in it. And, one of the things that I saw in an interview from him was that, okay, so, heart disease is one of the biggest health expenses in our country. And if 50% of it is related to the health of the mouth, I mean, it's kind of good news and bad news, right? The good news is that, if the population can be educated about it and we can all be more assertive about it, that means a lot of heart attacks and strokes are preventable.
Right.
But it's about, it's about having a new conversation, and a conversation not in isolation where we only talk about it in the dental office.
Yeah. And then, we talked a little bit about diabetes, and we've talked about, how in my practice, I certainly know, and most physicians know, that patients who are diabetic, often struggle with their mouth and the health of their mouth, and they struggle with having a lot of infections all over their body, but, obviously in their mouth as well. But there's sort of, that reverse causal link, as you had mentioned before.
Yeah, if they're not really closely controlled, and I think at a minimum every 3 months, and they don't get laser treatment when necessary, or use treatment trays with peroxide in them, their gum disease is going to be worse. And as their gum disease increases, it really decreases the likelihood that their sugar levels will ever be under control. And then it just keeps snowballing. So, yeah.
It's big. And in people who are pre-diabetic, or maybe have a strong family history of diabetes, looking at really taking care of their oral health could really, perhaps prevent, or delay the onset of diabetes.
Absolutely. Yes. It's definitely, it's in a lot of communities, it's almost considered as diabetic treatment.
Right.
And I'm sure most physicians, that are treating diabetes ask about it, but I think that those inquiries and that intake needs to be more specific with, doctor letters going back and forth between offices where there's actual cross communication, be it email, be it text messaging, be it, whatever, some sort of some sort of communication between the dentist and the physician about the status of the patient, which is just, it's really not heard of.
Yeah, yeah, it's true. I think that's an area of health that everywhere in health, communication amongst physicians, needs to be improved. You even see that within my dealing with specialists or other providers is just really trying to get that communication between providers, improved, because that, like you said, ultimately ends in better outcomes, for the patient. So, that's always an area. But like you said, even if it's just a matter of each, person on their end just trying to, reinforce these same concepts to the patient, hey, from our end saying, hey, did you get your last dental checked? And are you struggling with your dental disease? And are you bleeding from your gums when you brush? Those are just some 2 or 3 real simple questions for us to ask. And, if the answer is yes, just encouraging patients, to move forward to come and see you.
Mm-hmm. Yeah. Or, even getting, records and results from dental exams so that you can look at those numbers and know what they are, right? Because what I'm learning more and more is that, I'm reading articles and I'm reading information about, medical stuff. And I realize sometimes I don't know what, the blood work is supposed to look like. And so it's a wake up call that, we need to be educated about each other and about each other's standards so that we can care for the patient.
Yeah, and we talked about, coronary artery disease, and we've talked about diabetes, and, a lot of those things, tend to begin to really show their head in the, usually 4th decade when people are in their maybe as early as their late 30s, but, in their 40s and 50s. But, oral health can even have impacts earlier. There is a link between fertility and inflammation and in the mouth and preterm labor and inflammation and periodontal disease in the mouth. And that's something that I don't think a lot of people realize, that there are those connections. And if you're a young woman in your 20s or 30s, you may not necessarily be thinking about that.
Yeah, it's difficult. I think we all can. Well, I can barely remember back to my 20s, but I do remember feeling, bulletproof. You don't feel like you could ever have something that would have a significant effect on anything. But yeah, even minor gum inflammation that we all hear people call gingivitis, that bacteria still has a direct link to your system, and it can cause problems with the baby in utero. It also can decrease the likelihood that you get pregnant. So the health of your mouth when you're pregnant or trying to get pregnant is really important. And similar to diabetes, once you get pregnant, if you have a certain amount of gum inflammation and gum infection, pregnancy makes it worse. So we encourage our pregnant women to come in every 3 months, very similar to the diabetic patient. And the beauty of the custom treatment trays called ParaProtect trays that we use with that gel is that in pregnancy, it's very, innocuous. It breaks down to water. It's very simple to use, and it's definitely better than having bacteria in your bloodstream. So.
Yeah, and I know a lot of women who are contemplating getting pregnant or who are pregnant are very hesitant about what they do and what they use, and here's something, that's very simple, and it's very specific. From what I understand, you told me that, to the bad bacteria, and so we don't have to worry about good bacteria, bad bacteria, we're going to do something to it, It's very specific to that, and yet it's not going to be worrisome that it's going to, impact a fetus or in a harmful way.
Yeah, I've always struggled with, periodontal treatment and a lot of times decay treatment in people that are sort of chemical conscious. But the beauty of the Perio Protect trays is that hydrogen peroxide specifically affects the bad bacteria, because bad bacteria don't like oxygen. And as we all know, when you put hydrogen peroxide on something, it bubbles up, and that's what the bacteria do not like. They don't like all that oxygen. So yeah, it's a great way to treat it.
And another thing that you've always talked to me about, and we've had a lot of good conversations about, and that's sleep apnea. And we've talked about how that really can impact people's health. And we look at it from our perspective, when people have sleep issues, when people are having hypertension that we're finding difficult to control, when they're fatigued. But you come across this a lot as well, in your practice.
Yeah, it's something that we're really focused on. Again, for us, it's we're focused on it for two reasons. We want to impact people's overall health, and a lot of times, they've had a sleep test done 10 years ago. They were given a CPAP machine. It's in their closet. They wore it for 2 nights, and they are no longer being treated for it. And it's a difficult sort of personal thing to talk about, but we do have long-term relationships with patients. We sometimes see them every 3 months. So we've started discussing it with them, because we do a sleep survey now, partly just, again, to keep that conversation going. Even if all we're doing is discussing it with them every 3 months, if it's been untreated for 10 years, we have the hope that they will do a sleep test again. We are able to administer a home sleep test here, which is great, because a lot of people, their hesitation to do anything about their sleep apnea is that they don't want to go back to that sleep lab. And, if they have severe sleep apnea, it comes back on the report, and we send them back to their physician to get a CPAP machine. If they have moderate to mild apnea, we're able to treat that with an oral device, which positions their jaw and opens up their airway. And then we also have laser treatment that helps with the consistency and the mobility of the palate, by improving the collagen.
Yeah. It's good to, like you said, I think it's good to have both, providers or multiple providers, continuing to reinforce how, sleep apnea is something that often is silent in a sense, maybe not in the middle of the night if you're sleeping with someone, but, a lot of people.
Well, they get silent for about a minute when their airways shut off.
Exactly. But, a lot of people just, especially if you live alone, you don't realize, you may have this issue, and, until the significant manifestation starts. So, having, both providers address it is always great. I wanted to spend a few minutes here, before we wrap up, just talking about, you guys have a couple of unique options. We've really talked about how, periodontal disease and bacteria and inflammation in the mouth can affect the heart, can affect diabetes, can affect women who are contemplating getting pregnant or who are pregnant. So what else? You guys have some unique things beyond just cleaning and flossing that you guys have at your office, right?
For treating the gum disease you're talking about?
Yeah. You have the Perio trays. Tell us a little bit about those trays. What exactly are they?
Yeah. So they're custom trays, and they look a lot like an athletic mouthpiece, and they fit on the top and the bottom, obviously, because we're trying to affect the bacteria in the entire mouth. They have a gasket on them that goes up into the periodontal pocket, and the pocket is the distance between the top of the gum to the base of the bone when you have bone loss. The unique thing about that gasket is it actually shoves it all the way up to the base of the pocket, where those bacteria that are anaerobic, which means they don't like oxygen, are living. When we do traditional scaling and root planing, a lot of times it's a little bit like crabgrass, I say. You just kind of chase it from one side of the lawn to the other, and then it grows back. So when you put these trays in twice a day, 15 minutes each time, you are killing those bacteria over and over and over. The other awesome thing about the trays is it makes your gums super pink and super healthy looking, and it makes your teeth ridiculously white. And within 3 days, you have zero mouth odor, none, completely gone in 3 days. We also have a new laser that we've been using for about 4 or 5 months that allows us to do the pocket sterilization treatment, which has been around for a really long time. We just didn't have that technology in our office. So we're able to couple both of those things and not just ignore the inflammation anymore. I mean, even as dentists, we minimize the fact that, people have 3 to 4 millimeter pockets with bleeding. Yeah. We're just not doing that anymore.
Yeah. So I think like you said, to kind of summarize everything, really we're finding that oral health plays a large role in our overall health. We talked about how dental bacteria can be found in hospitalized patients who've had issues with who've had surgeries, knee replacements, or people who've had sepsis. There's been a link there. There's a link with heart disease. There's a link with diabetes. And there's a link with diabetes. Preterm labor and fertility. So I guess like you would say, I encourage people to go to their dentist, get checked out. Obviously do the good things like brushing and flossing, but maybe see your dentist a little more often. Maybe get some extra cleanings, and like you said, you maybe look into some of these unique treatments that you guys have, the perio trays and the laser.
Yeah, there are many dentists out there, and everybody out here is trying to do a good job. But you do want to make sure that your dentist is doing a periodontal exam where they're taking readings of the pockets, and ask about your bleeding points, ask about your pocket depths. The more educated the population is, the better, and the more likely we are to be staying healthy instead of trying to treat sickness. Yes. So that's our goal here, is to to head it off in the first place. So that we can live long, healthy lives, not just long lives.
Right. An ounce of prevention is worth a pound to cure. I know we're all balancing lots in our lives. We're trying to exercise, we're trying to eat right, we're trying to sleep, and now we're saying, hey, let's pay attention to our mouth. But like you said, there's just a lot of simple things that we can do, to fit in our schedule to make that difference in our health.
Absolutely. I completely agree.
Well, thank you so much for joining us today, Dr. Michelle. I really appreciate having you here.
Well, thank you for your time, too. Thank you, Darren.
So this is Dr. Michelle Huck. She's owner of Jack's Beach Family Dentistry. Again, that's Jack's Beach Family Dentistry, and it's located in Neptune Beach. Her website is jacksonvillebeachdentist.com. That's jacksonvillebeachdentist.com. And the phone number to her practice is 904-247-0111. I'm Dr. Cheryl Trudy. I'm owner of Balanced Physician Care. That's Balanced Physician Care. And we're also located here at the beaches in Jacksonville. Our website is balancedphysiciancare.com. And our office number is 904-930-4774. We offer a general primary care practice. We do something unique called direct primary care, which is a membership-based practice. So for people who are really looking for something different and unique, we maybe with their health insurance in the coming year, we encourage you to take a look at our website and check it out. We'll be doing some upcoming Facebook Live presentations in the new year. So check out our website, balancedphysiciancare.com, for those things. I know also, Dr. Michelle, you guys also do a membership-based practice as well for those people who might not have access to dental insurance.
Yes, we have a membership plan also, and I urge people who are heading into the new year and they're confused about their benefits and have questions and would, like help reviewing them. I have an amazing administrative team that is really educated about traditional insurance and, can help people make educated decisions about, whether they really even need dental insurance or whether a membership-based thing makes more sense for them.
Yeah, absolutely. So JacksonvilleBeachDentist.com, Jackson Beach Family Dentistry. If you're looking into those things, I encourage you to check Dr. Michelle out. Again, thank you so much for being here today, Dr.
Thank you.
Michelle, and we look forward to doing future stuff with you again.
Sounds great. Have a good day.
Have a good day. Wishing everybody a very Merry Christmas and a happy holidays, and much health in the new year.
All right.